There's a long history of chiropractic in my family, and I'd been under chiropractic care as a result of that kind of my whole life. I really like the fact that the idea that you could correct a problem, get better from it, and not have to continually have it maintained and do a lot of therapy to keep a decent quality of life. So when patients first come in, we really want to dig into what's going on with them. And so we do an in-depth history, we go through all of their past injuries, surgeries, what kind of treatments they've done, whether they've seen any success or not with those. With all that information, we try and determine exactly what's going on with them and where the root of their problem might come from.
I like it because it's less aggressive and it's successful, and I don't have to continually see a chiropractor because I've healed and maintained my adjustment, which is why you seek out help. You don't want to constantly have to pay to see a doctor, you want to be better, and that's where I'm at.
The cases I like getting most are the worst cases. The people who have chronic issues, who've never gotten better, never gotten the results, because we can provide them a look at things that is different from the way most people look at things.
I had a lot of issues with my back, was not finding any relief. So a girlfriend of mine had recommended Dr. Kuhn. I came to see him in October of 2017 for a treatment, and this is now May, and I have been feeling fantastic.
I wanted to work in a healthcare environment of some sort. Nuka makes really sense because when you're looking at the upper neck, it's the most vulnerable area in terms of a misalignment of the spine. If you look at the rest of the spine, it's very solid, held together by strong ligaments and interlocking joints. The upper neck is very freely mobile. So when you're going to have some sort of accident or injury or stress placed on the body, the likely area to give out is the upper neck.
I was in 3 car accidents in a span of 2 years, which was really hard on my neck, and I had a lot of headaches, and then I had a baby. And the pain that I would get was just unbelievable. And I saw many different chiropractors, but I had heard about Nuka, and I tried it out, and he worked. I was staying in alignment, and I was able to carry this big baby around.
We're taking a different tack, a different approach to their problem than they've ever had done before. We use some motion capture for you doing the range of motion and is able to measure really precisely how the head is moving. It measures how far you move. It also shows us how you're moving. The best part of my job is the fact that we get to give hope back to people who've lost it. The fact that they can get better, that they can be better, and that they don't have to continue to have something constantly being done to them to maintain any kind of level of life is really rewarding and valuable.